Hi, I'm Mary Claire Gao, your student midwife for today. So today, I'm going to demonstrate the types of medication administration through injection, which is intradermal, intramuscular, and subcutaneous injection. So I have the equipment prepared here. I have syringes, gloves, sterile water used for this as serve as medication in this demonstration, forceps, kidney basin, cotton balls with antiseptic 70% alcohol solution, then trash bin for sharp and other hazardous materials that we use for this demonstration. So first, I'm going to perform intradermal medication administration, where we are going to inject a small amount of medication into the dermal layer of the patient's skin. This is a skin test for we to know if the patient is allergic to that said medication. Some medication need skin tests are like penicillin and other antibiotics. So first thing to do, obtain needed special information prior to that administration of medication. So check for the doctor's order. Know the name of the patient and the time and dosage should we perform a skin test. So after we know that information, wash hands or cleanse hands using an alcohol for we to control infection procedure. So now, gather materials and supplies, so we already have here. Then be sure that our work area are clean and well prepared to avoid any contamination or infectious around the area. Then verify the medication administration through comparing the MAR or medication administration records. Check for the expiration of the medicine and the syringes for the patient to be safe. Then prepare the medication. So when preparing medication, verify the 6 rights of medication administration. If we are giving a right medication into the right client with the right dosage at the right route with the right time and right documentation. So now, prepare the medication, the right medication for the right route. So since it is intradermal, I will be using the 1cc syringe. Then I will change the needle into the aspiration needle to draw the medication. Here. Put it back. Then going to skin test at 0.1 ml. Inject into the vial. Top, there are some air inside. One 0.1 ml. Then top, remove the aspiration needle, then discard, then connect the needle that we used to inject. Okay, then put it in. And now, after we prepare the medication, go to the client room. Identify the right client and explain to them the procedure. So hello, I'm Mary Claire Apgov, your student midwife for today. May I know your name and your birthday? So now, Miss Redbear, I'm going to perform a skin test for which to know if you have allergic reaction in the said medication prior to the doctor's advice. Is that okay for you? So, may I ask you a question? Do you have any history of allergies from taking a medication or injection? Alright, so now, put gloves on before we administer a medication for us to be safe from any risk or from any contamination, cross-contamination among the clients. So now, after we put our gloves on, sites for the right route for skin test and be sure it is the right time. So now, I'm going to give a skin test above the wrist of the patient. Inspect for any redness or tenderness to the skin of the patient. Before we perform the skin test. And now, check for the skin swelling and tenderness. And now, check for the skin swelling and tenderness. For injection using a cotton balls with antiseptic alcohol from in to out, in to out. Then discard. And now, uncap the needle Then, slowly inject to the patient's skin within 10 to 15 degrees, just like this. Then aspirate. Then remove and put a dry alcohol, dry cotton rather. Put a dry cotton without massaging the area where we inject. Then label, encircle the waveling. Write the date and time we inject. After that, instruct your client not to massage the injection site and erase the data we write here, the injection site, for us to have an accurate result. And say, thank you ma'am for your cooperation. I'll be back at a few minutes. That's all. Then, remove our gloves. Discard unclean hands or wash hands. So, after we've done the medication, record the procedure and write medication we've done, including the date and time, medication, the right route, and the right site, including our signature. And at the end, be sure that the syringes and other materials we've used for this injection are discarded properly. So now, I'm going to demonstrate intramuscular medication administration, or abbreviationally known as IM injection. So these IM injections are usually used in giving a vaccines like measles vaccines because it targets deep into the muscles. So most sites of these IM injections are in the deltoid, vastus lateralis, and the gluteal. So the procedure in this intramuscular are just like in the intradermal, where we check the accuracy of the medication or check the doctor's prescription. Then, check for any contraindications like allergies. Then, perform the 6 rites of medication if we are giving a right medication into the right client with the right dosage at the right time in the right route and right documentation. So now, before we prepare the medication, be sure to wash our hands to avoid any contamination or transfer of microorganisms. So, take medication and compare it into the MARS or medication administration record of the clients if it is the right medication prescribed by the doctors and if it is the right dosage prior to that medication for the client. Then, check for the expiration of the medication and the expiration date of the syringe that we use for this injection. And now, aspirate the right dosage we need for this intramuscular injection. So we will be needing a 2 ml for this. Remove the original needle and change it with aspirating needle. And now, open our medication to vial. Then, cleanse it with alcohol and antiseptic solution within 10 to 15 seconds. Then, keep it dry. Discard. And now, aspirate the medication, uncap. Check for loosen the plunger. Then put an air inside 2 ml. Then uncap. Inject into the vial. Then stop for any air inside. Then close and change it to its original needle. Then put it in the kidney.
And now, go to the client's room, introduce yourself, verify if it is the right patient need an intramuscular medication administration, and explain to them the procedure of what we are going to do and why we are going to perform an intramuscular prior to the doctor's prescription. Explain to them the procedure and to gain their cooperation. Then, wear clean gloves and choose appropriate site for intramuscular injections. So for this demonstration, we are going to inject in deltoid here, deltoid. So now, the appropriate site for intramuscular are deltoid, above the acromion process. Clean the site for injections with alcohol and antiseptic, with cotton and antiseptic alcohol solution. In and out for 15 to 30 seconds. And then, prepare the injection. Uncap. Then, inject at the 90 degrees angle. Inject at the 90 degrees angle. In intramuscular injection, we need to aspirate. If there's a blood in it, it means we
Preheat the veins or arteries. If not, then proceed. Release and put and dry cotton. Massage the area for the medication to spread in the muscle area.
So, some vaccines are given subcutaneously. So, the procedure in subcutaneous injection administration are the same in intramuscular, but it has different angle and different sites of injections. So in subcutaneous, the site for these injections are in the fatty tissue of the upper arm and the thigh. So here, fatty tissue. Pinch. Then, clean the sites for injections with cotton and alcohol. Prepare the syringe. Uncap the syringe. Tap for any bubbles or air. Then, inject at the 45 degrees angle. Like that. Inject and don't hesitate. Then release. Remove the needle. Then put a dry cotton. Don't massage the area. Apply pressure but don't massage the area. And now, remove gloves. And discard properly. Then, wash your hands. Don't leave the medication unattended. Then, after the procedure, write the document prior to the procedure we've done, including the dosage, the patient, and the time we've done these injections.